Welcome to AME's facilitated sessions where mastery and mentorship unite to fuel your success in medicine. Today, I'm joined by my co-host and expert facilitator, Dr. David Leon Taylor.
Yes, welcome back, DJ. Welcome back to our aspiring physicians. Good to see you. And DJ, it's always exciting to be right here at AME Facilitated Session.
Good to have you. And I am your co-host and moderator, Dr. Darren Wayne Jackson II. So before we jump in, audience, if you like what we're doing here, if you like the topics that we're covering, the information that we're giving, please like, subscribe, and share the content. This helps to grow our channel and it helps to get this very important information out to pre-meds, meds, medical students, residents, and across the whole spectrum. So
Excellent.
please do that. Now, with that being said, are you ready to jump into the topic for today?
Absolutely. It's a hot one.
All right. It is the USMLE Series Playbook for Success.
I love it.
Today, we're going to be covering the USMLE series, so step 1, step 2, and step 3, and looking at the differences between each of those exams and how, as student scholars, we can attack success on these exams. So, with that being said, let's just kind of talk about the format of today. So we'll break this down into 3 segments. The first segment is the focus. The second segment is the format, and we'll talk about what the focus and the format is. And then the third segment, we all know the student scholars will love, is the bonus section, which are the
The
questions.
questions,
And
the
that's going
questions,
to
the
be
questions.
a good bulk of what we do today because we want to demonstrate those very granular differences that exist between the step 1, step 2 CK, and step 3 exam. So wherever you are on that exam trajectory, on that exam course, you will have some type of awareness about how to attack the study plan, and then also in real time when you're actually going through those questions. And so the bonus section will put some of the things that we're going to go through in the
Exactly.
focus and the format segments and then put it to practice. So you ready to
And
jump in?
yes, and I want to thank our scholars because we know our scholars love doing the application component, which is putting what we say into practice, right,
Yes.
for their success.
Yes. So let's start off with segment 1. All right. You ready for it?
I'm ready.
Core comparisons of learning objectives. So, DT, tell me, when we're talking about these exams, what is the primary focus for the USMLE exams?
So often, we talk about what we call the blueprint, and we have a lot of blueprints. And the blueprint is important to know for any examination because it guides how you are going to specifically prepare for your successful engagement of that particular assessment. And so when we look at step 1, DJ, in a nutshell, the focus is on the basic biomedical sciences that our scholars learn in their first 18 months to 2 years of medical education, depending on their curriculum. It's the core biomedical basic sciences, pathology, physiology, microbiology, etc.
Biochem, stuff like that.
All the
Hmm.
favorites.
Yeah.
That's right. Biochemistry, gross
Histology.
anatomy,
Yeah. Hmm.
microscopic anatomy, etc. Exactly. Then when we move to step 2 CK, the CK is for clinical knowledge, the focus now moves to what we call supervised clinical science or supervised patient care, where the scholars, of course, are in their clinical clerkships and they are applying that biomedical science that they mastered for step 1. They are applying it to actual patient care to the clinical concerns of their valued patients. And
So
so
this
that's,
upgrades it a little
oh,
bit. So now
yes,
we're not just looking at what this clinical case is. Now we're expanding the scope of what we're expected to learn and how we're expected to manipulate this information in a
exactly.
clinical context.
Exactly. And we're going to see in a moment that that even goes to another level with respect to the step 2 CK. Not only an understanding of that clinical science with our patients, but now how do we actually use it under a supervised situation with our residents and our attending physicians working with the medical scholars. Now we move to step 3, and that's the final assessment in your medical licensure series. This is now for patient management. Are you able to manage patients on your own? And now we have advanced work with respect to our clinical knowledge and how we engage patients, etc. And so we can see very clearly three distinct areas of focus. You start with foundation of your biomedical science. We use that biomedical science, right? Step one, now to integrate it with the medical concern or clinical context of your patient. Step two, CK, clinical knowledge. And you begin to use the information to, of course, work with our other healthcare team to reconcile that medical concern, but supervised. And when you're in step three, that assessment says now, are you ready to manage patients independently?
The manager.
That's right.
Hmm. Now, now that we have like a idea of what the primary focus, and we talked about the differences between each one, let me know a little bit about what the goal is, because we talked about, some students, we talked about this, a reaction where, is this just a pledge, a haze
Yes.
process? They're just hazing medical students by taking us through these exams. What is the goal that the USMLE examiners, the test
Mhm.
writers, what are they trying to get from the students? Are they actually just hazing us, or is there a goal to this?
There is an actual goal, and part of that goal is to have you become an outstanding physician. In order to do that, now, first, the first goal related to step one is, are you able to understand the underlying mechanisms that are playing throughout the human system across these biomedical sciences? So, when we talk about mechanism of disease, in essence, we're focusing a lot on pathophysiology, and pathophysiology involves a lot of aberrant biochemistry, aberrant physiology, etc. And so now we can appreciate we're hearing all those basic sciences, the biomedical sciences there, but everything has gone awry. So step one says, are you able to recognize what is wrong? And we may even frame it in a clinical context, but we want you to understand what's wrong with the underlying biomedical science.
So, quick question. So, you're saying mechanism of disease, but I heard the word mechanism. So, I think MOA, mechanism of action.
Yes.
Is this where, from a pharmacological standpoint, we are including like with the mechanism of action, because there is that distinction between the exams that we mentioned and we covered in a previous FS
Yes.
episode about management of medication
Yes.
versus the actual
Let's break
mechanism.
that out some more.
Mhm.
So, when we look at first mechanisms of action as it relates to pathology, we're looking at what are the normal processes that now are not working well. And that means you've had some change in your normal physiology, the normal process of how biochemical mechanisms work as it relates to certain cellular function. It could be some abnormality in the normal cell structure, so that's histopathology. All of those components could be part of a pathophysiologic process. If we look at it microscopically, sometimes we call it histopathology. So we're getting into the science, right, medical scholars? Now, when you referenced the pharmacologic mechanism, this first relates to how medications work, and the underlying process of any medication is some biochemical mechanism. So, on step one, in addition to the pathophysiology, we also appreciate what are the normal biochemical mechanisms that support drug therapy. And on that's
Pharmacodynamics,
right. That's
pharmacokinetics.
correct. Pharmacokinetics and pharmacodynamics. And that part is normal, but you're looking at a biochemical mechanism that's underlying that for the drug. So step one will focus on that piece. As we move to step two CK, as it relates to pharmacology, we're now looking at the actual drug or medication therapy, because you are treating patients under supervision. And so your step 2 CK exam and eventually your step 3 exam will have a lot of what we call pharmacotherapy, where you must know the actual drug that you're going to use to assist the patient if if a pharmacologic intervention is warranted for that patient and not a surgical or some other intervention. So it's a good tease out in terms of step 1, your pharmacology is normal mechanism of action, which is what is the biochemistry that facilitates, and to some extent, physiology,
Right.
because we have
How it
physiological biological
overlaps. Yeah.
receptors that these medications attach to. All of that's part of your pharmacokinetics, right? And pharmacodynamics. All the other components, though, under pathophysiology are abnormal components of the normal biomedical sciences you'll see. So that is now the goal for us to understand that for step 1, for step 2 CK, outside of pharmacotherapy, was the actual drug action. It's how are you going to treat the patient? So it's the initial work of the patient, diagnosis, and then the next step in management. So now we're ready under
The next
supervision.
best step.
That's right. Next step. Sometimes they'll say next step. It may say next appropriate step, or it may say next best step. And those are 3 different situations. So when we get into a later segment with the questions, the format and the questions will break that out, because that's critical to understand in terms of how we, under a supervised context, treat patients. And that's what step 2 CK is assessing. And then step 3, which all physicians such as yourself have fun with, which is the final part of your licensure, that goal now is, are you ready to manage patients unsupervised? Meaning you are doing this now on your own.
Right.
So it's an advanced level now. You obviously can do the diagnosis and workup of the patient. You obviously can do the next step in management, whether it's appropriate or best, but you also have to do long-term management. The patients are more complex. There could be comorbidities. And so there's a lot more advanced clinical skills, reasoning, and integration involved in that process. And when we look at the format of the exam, we'll see that exam, we'll see in a later segment, actually goes over 2 days.
And the key word that you said for step 3 in this goal piece is the unsupervised, because the thing to note for that is once you're transitioning, taking your step 3 exam, a lot of programs will then allow the trainee to then moonlight and do outside jobs, because now the expectation via passing step 3, the last exam on the continuum, is that you can now make this management from a unsupervised standpoint. Is that
That's correct.
correct?
That's correct. And that is one of the reasons why at the top of the discussion, we did have a little fun with, and some of the reactions, sometimes medical scholars will joke, hey, are they trying to haze me with this USMLE series? Or is this really an area that is, yes, part of my licensure and it can be stressful, but I have to be able to demonstrate those competencies? Yes, this is part of your professional identity and responsibility to demonstrate the competencies of medicine, to have the privilege of the most intimate aspect of the human condition, which is to have a privilege in working with someone's health.
Yes. Now, we talked about those primary focuses. We talked about the goals of each of the step exams.
Yes.
How are we being assessed, the students? So, what are some common tasks that the USMLE exam, test writers are assessing the students? Like, how do they frame it in these question vignettes to assess whether or not we know what to do for each of these goals and primary focuses?
You really put a nice, I would say, framing, if you will, on that
I
question
was
that you
looking for
just
the
asked
words,
me.
yeah.
It was great because a lot of times we joke about, who are these people writing these questions? Are they sitting in a smoky room somewhere in the back, and what are they doing? Well, we want to remind you that these are outstanding clinical and basic science faculty who have expertise in these respective areas, who are attempting, and they do it very well, to construct questions that address the different competencies that you're expected to have as a physician. So it's taken very seriously. So when we think from that perspective, those faculty who are writing step one questions, the clinical context of vignette is attempting first to see, do you recognize that there is a clinical context to any change in the mechanisms of these sciences in the human condition? Because your understanding of how, if a transport process is not working, how that can lead to an acid-base disturbance, how that could lead to a cardiac arrhythmia, your understanding of that is going to be critical to you being able to determine what is the medical concern of the patient and how are you going to correct it. So again, step one, the task is recognizing the aberrant mechanism, or understanding, that's for the pathophysiology, or understanding, as you said, the pharmacologic mechanism if we're going to be using a drug. That's step one.
So outside of asking general diagnosis questions, how does the exam writers do that for step one? So we do know like what, what's going on in this clinical vignette. Is this a acute pancreatitis? Is this a gastritis? Something along that lines. What are some other ways via these common tasks that they assess?
Well, your majority of questions, let's start with the last piece you just gave. We call it on step one baby diagnosis. So, baby, that's right, popcorn. Baby diagnosis is a general description of the medical condition. So, you will see on step one what is the diagnosis for this patient. And if they give you that question, it is the general principles such as gastritis or heart failure. But there are many different types of heart failure that we have to understand, and we get into the details of that in step 2 CK and in step 3. There are many different types of gastritis. Again, the details of that in step 2 CK and step 3. Now, that's a smaller portion of the questions, maybe about 10 to 15% of the questions. The larger percent of the questions that you're going to see, 85 to 9% of the questions, will all start out as if they're going to ask you what is the medical concern, and then they tell you what it is. They say the patient is in renal failure. Which of the following is the underlying pathophysiology of this patient's condition? Or they won't say the patient is in heart failure, but everything in the clinical vignette is screaming heart failure. And then the question will be, which of the following electrolytes is likely in some disturbed context? Right?
I'm
And they go on and
sidebar.
on.
I'm smiling because, you know, as a student, I can recall many times reading a vignette and knowing, oh, this is renal failure, and
Yes,
then it says in the vignette renal failure. I'm like, man, well,
that takes care of that.
yeah, I'm not going to be able to that won't be an answer, so they're going to be asking something else. But this
Correct.
whole time I'm going through the question thinking, if they ask me the diagnosis, I got this one, and then it's like, this patient has renal failure, and then it asks you something a little bit more
Exactly, because again,
detailed.
as we
Yeah.
said, 10%, 15 to 10% of the questions, right, are going to be the baby diagnosis. Everything else is going to be the, in essence, underlying pathophysiology or some infectious mechanism. So let's think about it. For step one, under those common tasks, we can ask you these questions across every biological system: cardiovascular, pulmonary, renal, gastrointestinal, musculoskeletal, neuro. Do you see how much fun we can have across all those systems? Now, we will ask a few of these questions too. Sometimes we may just ask you a direct biochemistry question. We may ask you, what is the committed step for a particular pathway, a metabolic pathway or some other signaling pathway? We may ask you, a direct question related to microbiology, instead of giving you a clinical vignette that says, in essence, the patient has some type of upper respiratory infection, we'll just ask you about a particular microbe. We can do that. But those questions are very few. The majority of questions are integrated by system. So if I ask you a cardiovascular question, I could ask it from a gross anatomy point of view, an embryological point of view, a physiological point of view, right? An underlying aberrant biochemistry. So there are lots of ways we can weave in those, what we call biomedical sciences, microbiology, physiology, biochemistry, the different anatomical series, into a system to make it integrated, because that's what you'll be doing as a physician. So that's what we see on step one in terms of what are the tasks that you'll be expected to do when you see these questions. It's going to be mechanism focused. Mechanism focused. That's going to be the key.
So step two.
Step two, CK. Well, now it's time. Remember, the goal is to have you do clinical work under supervision. So the tasks that we're creating in these question formats now are determining, can you actually work up a patient to come up with a diagnosis? And the diagnosis may be a more detailed one. You may have to come up with a differential list of diagnoses, different possibilities, and then an actual diagnosis. But it's going to be very specific, right? So as we said again with our heart failure, well, I don't know. Is it going to be right heart failure, left heart failure? Should it be eccentric, concentric heart failure? And we just
Preserved
keep
ejection fraction.
there. Here we go. That's right.
Reduced
That's
ejection
right. Is it
fraction.
hokum? So
Right.
we have a whole lot of things that are going to be happening now. We can get very, very specific. So your integration of your clinical skills and clinical science knowledge now, the key task is synthesis of all the information, give us a diagnosis, and once we have a diagnosis, we may even ask you, well, how do you manage it? What's the next step to manage this patient? What are you going to do about it now
Because
that you
it,
know what it is?
because the key thing there is that the difference between those different types of heart failures comes in the information in the vignette.
That
And
is
so
correct.
the exam writer is expecting you to be able to piece out what those echocardiogram
Mm-hmm.
findings mean,
Mm-hmm. Mm-hmm.
what the vital signs mean, and then being able to synthesize all of that additional information in the history of the vignette to say this is reduced ejection fraction heart
Mm-hmm.
failure
Mm-hmm.
versus some other form. So it ramps up the integration and just the overall base of knowledge that you have to know for this exam, because having the ability to be able to separate those minor, those details
Mm-hmm.
between the different types of heart failures is what's in the focus of, how you
Mm-hmm.
study.
Mm-hmm. And this is a very good point, because now what you've underscored and you've given a common attraction to is when we get to segment two and we look at the format of the test questions. And you just gave one of the key pieces, is that one of the ways we can differentiate between a step one or a step two CK or a step three question is what information we put in the vignette. And for step two CK, because you're required to provide a more specific diagnosis, we have to give more specific information in terms of what the patient is experiencing, or what we receive from imaging, or what we receive from labs. Whereas in the step one question, we may put a small amount of that type of information there, because primarily we're getting ready to move toward the mechanism,
Mechanisms.
but it's enough to create a clinical context. The step two CK, oh, it's going to be a detailed clinical context. And step three, hold on to your seat. It could be a lot more, because you're supposed to be able to engage the patient in an unsupervised manner and manage their care. And so as we move to whether the task we're expecting for step 3, now that you've mastered step 1, step 2 CK, step 3 is going to be, well, what's going to be the long-term management? Right. See, in step 2 CK, I've made a diagnosis and I've started the management process. Sometimes that first level of management may be sufficient. Patient gets well, ready to discharge. But what step 3 does, it says, you know what? Sometimes your patient's going to be sick for a little while. So we need you to manage them beyond 24 hours, 48 hours, 96 hours at some point. So you're managing the patient over several days. And so the vignette becomes complex and gives you a series of data in terms of patient presentation, timeline and course of disease, series of labs and imaging that's been done over 1 to 2 days, results that come back that you must interpret. So you must gather information, synthesize it, and then based on your analysis of that, determine what may be the advanced level and long-term management of the patient. That's step 3.
Because and more layering. So for this step 3, especially when you're talking about maybe going outside of that acute context, right? So you're saying a more chronic management of this patient and their issues. But then, as you said before, the comorbidity piece, because treating a disease as a singular disease is one thing, but that management might change depending on what additional comorbidities you add to the patient's profile. Does this patient have hyperlipidemia, also diabetes?
That's a personal favorite
You know,
because
all these
conditions that affect multiple systems like diabetes
right.
can create complications, right? In terms of how you're trying to manage the patient, because in the case of a diabetic, if their glucose is not appropriately managed, it has impact on other systems that then can create or exacerbate whatever the patient's chief complaint
Right,
was.
exactly.
Yeah, so this is where the advanced thinking comes in.
And then additionally upon that is that the more comorbidities, you may have more medications that this patient is taking. Yes. So now if you are assessing and treating a new acute issue, or maybe something that's chronic that wasn't addressed before, the medication that you are now given for this now presenting issue today that you're being tested on, how does that medication interact with previous medications that this patient is already on?
Excellent. So let's take up on that one right there. One of the reasons why you call this the success playbook for the USMLE series is because when we start with excellence for step 1, the anchoring biomedical science, understanding mechanisms of disease, understanding mechanism of disease and how normal pharmacology works, the pharmacokinetics and pharmacodynamics, is going to help you when it's time to start managing patients under a supervised condition for step 2 CK, because in understanding the aberration that's happening, that informs what your intervention is going to be. It also informs how you might consider a pharmacologic intervention, drug therapy, how it works to correct that problem. And if it's an advanced concern, as we know, there are sometimes adverse drug interactions. When more than one drug is in the system, there could be an adverse interaction. You said patient with comorbidities, or it could just be an adverse response to a particular drug. Right. So in step 3, also in step 2, but in step 3, you have to assess all that. And that assessment requires all the understanding from step 1, your then advanced understanding from step 2 CK, where you learn how to actually diagnose and manage the patient. And now you're doing this unsupervised in step 3. The series. That's why the success playbook is so important, to understand how each of these exams or designed, and that it's not to put you under a microscope just for the sake of doing that, but it's to help you demonstrate from all of your other experiences, clinical experiences, and medical training, that you actually have the competencies to treat patients. Something
And
else, isn't it?
so this was a really good deep dive into that granular details of each exam, because you see that layering when you get to that step 3, how that comorbidity piece or how that chronicity of the disease presentation changes things. Because if you're talking about diagnosing primary hypertension, in the vignette, did we discuss that this patient had already come in for a elevated hypertensive reading? Or is this the first hypertensive reading where we're considering this white coat hypertension, and we know we need an out of office reading in order to be able to diagnose primary hypertension, then to start our algorithm of treatment? So that layering of step 1, step 2, step 3, understanding it from a core competency and comparing those core competencies is very important. So that leads us into our second segment of today, which we are learning about the format. So this is the blueprint, the format. So DT, this is your wheelhouse, you know. So you tell me a little bit about. So we'll break this down, because right here we have format types. We have 4 format types, and this is the ones that we want to focus on today's FS session. So I'll say them: single item MCQs, sequential sets, this is format type 2, abstract drug ads, this is format 3, and then simulations, format 4. So I want you to take me through how these format types look through step 1, step 2 CK, and step 3. And then also, if you can layer in some just a little bit more information about what does a step 1, question load look like versus step 2 versus step 3. I know earlier you talked about the 2-day schedule for step 3. So just give us a little bit of information. Let's start with single item MCQs.
So you're having fun with this because you know this is a loaded question, and I need to be careful with our wonderful audience because I get a little excited about this, so we're going to slow it down. But the reason why I get excited about it is because once we understand first the focus of each of these exams, their goal, and the task we're expected to do, that information now sets the stage for how they're going to design the questions. You see, when you know how the questions are designed, and this is publicly available, but no one actually focuses on it. When you know how the questions are designed, you can actually appropriately study for them. When you understand the focus, goal, and common task for each of the exams, you can actually study that way. And I always say, if I knew, DJ, you're going to ask me the question that way, wouldn't I study that way? So let's get into the format in this segment 2. Each of these 3 exams, step 1, step 2 CK, and step 3, they all have what's called the multiple choice or single item multiple choice question format, which is will give you anywhere from 5 to 7 options to choose from. It can be up to 13. That's called an extended MCQ matching, but most are 5 to
When you
7
start
options.
seeing E, F,
That's
J,
right.
K, like,
They start
wow.
experiencing tachycardia. After the EKG start
Yeah.
flipping, right? So most times it's 5 to 7 options, right? Preceded by a question, which is preceded by a paragraph of what we refer to as the clinical vignette. Most of you are familiar with this from your practice question banks and also from the National Board of Medical Examiners, NBME practice assessments, right? That we've talked about in the previous FS. So these multiple choice questions or single item multiple choice questions means there is a single best answer. There is one best answer, and I heard right there the nice what we call it's called a sigh with a smile, because as a physician and former medical student, I'm sure you're about to say, but it seems like there's more than one answer.
Especially when you start getting to step 2 and step 3, because
Yes.
a lot of times, a lot of the answers are actually a part of the vignette. But
Yes.
the again, the chronicity, what exactly is the question asking? That makes it the best answer, not so much that the rest of the answer choices are incorrect. It might actually fit within the clinical context of the vignette, but it might not be the next or single best answer.
Now, as you know, I'm holding my seat. I'm keeping myself in the seat right now because, as one of my former scholars, I get very excited when scholars are able to tease that key piece out. Let's say it again. One of the ways that we assess your ability to make appropriate decisions is there are options that are part of your A, B, C, D, E, or F, or G, sometimes more, but they are not the single best answer because they do not answer the question. They may be associated with what you're reading, but they do not answer the question. So, in our later segment, when we bring you those questions, we will be assessing not only, and you're going to be working along with us. It's not just going to be Dr. Jackson. You're going to be right there with us. We
I'll
know
be
you're
in the
out there
hot
working the
seat.
questions with us. It's not only what is the knowledge that I need to understand and apply. I call that knowledge competency. It's not only your thinking skills competency. What do I need to analyze to appropriately interpret the information and make a reasonable decision? But it's also your testing skills
The
competency.
trifecta.
That's right. Why is one answer the single best over another? Because not only does it answer the question, but it's the most complete that aligns with everything else that you've been given. And that's why we're going to be doing that segment 3 so we can practice questions, because a lot of times that's easier said than done. So this single item multiple choice question format, which is a format that's used across step 1, step 2, step 3, and in a lot of your current courses and exams, we really got to master that. We have to master that skill set, both from knowledge, thinking, and testing skill, to be successful. And that's the first one that everyone's going to see across all 3 of those assessments.
Okay. So that's a single item, multiple choice question. That's format type 1. Now let's jump into format type 2, because now this one, I know, yeah, the sequential sets. You get to that
Yes.
first question and you got the second one coming up. You can't go back to the first one.
That is correct.
And once you proceed to that next question, a lot of times you'll either know if you got the first one right or wrong. And it could be a good, a nice motivator, or it could be something that you really got to ground yourself in the moment for to keep going, to keep that confidence. So give us a little
Because there's
bit of
no going
information
back.
about the sequential set format type across the continuum of the USMLE step exams.
So, sequential sets of questions, first of all, they are still single item multiple choice questions, but they come in sets of 2 or 3. And that's why you're smiling again. There was a sigh and a smile. They come in sets of 2 or 3 because we are assessing your continuing thinking engagement across a medical condition of a patient. Let me say that again. We are assessing in this sequential set of questions your continual engagement of thinking across a patient's condition. Therefore, based on that, you will not see sequential sets in step 1, because step 1 focuses on primarily mechanisms and we exit. That's right. But step 2 CK, remember, we may want diagnosis and then the next step in management. That's 2 questions. So we can give you a clinical vignette, and in the first aspect of that clinical vignette, give you a series, right? Give you multiple choice question, and we ask you, okay, what's the diagnosis? Then there's a follow-up question, and it says this relates to the same patient, and they want to know, what's the next step in management? Or they may say, what's the initial step in management? What's the first thing you should do? Initial. What's the next step in management? Next applies if there's a series of clinical actions you should be taking. We call that clinical algorithm. And they may have given you in the vignette a few of the steps already. So when they say the next step, you have to know the clinical algorithm because maybe in the vignette, they gave you steps 1 through 3. So the next step is step 4. But guess what? Option A is step 5. Option B is step 2, already done. Option C is step 4, the one you may be wrong. So
Right.
again,
In the vignette, they've already told you that you've seen the
exactly,
imaging. Now you should know the next step is laparoscopy.
you have to know the next step.
Yeah.
So that sequential set of questions really does get into the advanced thinking. And hold on to your seat. When you move to step 3, it's just more advanced. We have this sequential set of questions, and now it may be initial management, and now it may be long-term management. It may go over the course of 3 or 4 days. Maybe you'll get 3 to 4 questions because we're looking at your ability now to manage the patient long-term. That's called sequential set of questions. And man, hold on to your seat. If I was reviewing chronic bronchitis for step 1, I'm focusing on the underlying pathophysiology, the mechanism of the pathogenic condition, right? If I'm looking at chronic bronchitis for step 2 CK, how do I make the diagnosis and what would be the initial or next step in management? If I'm looking at chronic bronchitis for step 3, well, I could have several questions because I have to be able to manage the patient over a couple of days. Some patients with chronic bronchitis, unfortunately, are really sick, and it takes a couple of days to resolve the issue.
And that chronic bronchitis could have been now escalated to other events. So now we have a heart context to add into it now.
Exactly.
Um,
That makes it real fun, doesn't
yeah,
it?
exactly.
So, just in that one exemplar and understanding first the different focus of the 3 exams, and 2, understanding the question format. We've only done 2 of them so far. If I were looking at a common clinical context, that's how I focus my study because I knew you're going to ask the question that way, so I study that way.
Mhm.
Isn't that something?
Yeah, it is
That's why I'm
something.
sitting in my seat because I'm getting a little excited right now.
I know you're getting
Maybe in
excited.
the future, FS will bring in the whiteboard.
Maybe.
And we'll just go
Maybe.
to the board.
Yeah.
Maybe
It'll really.
we're gonna do a live facilitated session with our studio audience soon in a couple of different cities, and we're gonna invite audience members to the whiteboard to engage with us. How about that?
It's that LA4 med dent suite, back in the day
That's
nostalgia on the
right.
whiteboard, but it really locks it in. So, I ain't mad at it. We could do that. All right. Let's jump into this third format type because the format types as we go on just gets more and more grimacing. So
Yes.
this third one is called abstracts and drug ads. Now I'll be real with you. When it comes to some of the bio statistic stuff, even though I have my MPH epidemiology, fairly good with the biostats, just the cognitive switching. Remember we talked about earlier the cognitive switching the cognitive switchboarding of biostatistic information to like general clinical science information sometimes is too much for me. So I will tell you I save a lot of the biostat stuff towards the end, but biostats isn't as bad. But one thing that I could tell you when I see it, I'm like, oh, for sure I'm skipping are the drug ads.
They are challenging. They are very challenging. And again, they are not there as part of what we call academic haze, as we like to joke.
Are you sure?
We're very, very sure. It's so funny. They are there because as physicians, we are continually evaluating new pharmacotherapies and whether or not they're appropriate for our patient. So we have to be able to appropriately use our underlying basic science knowledge of pharmacokinetics and pharmacodynamics and our clinical science knowledge in terms of how these medications work within the human body to determine whether a new therapeutic agent is appropriate for our patients. So we will see primarily on step 2 CK and step 3, you will see actual what we call drug ads or science abstracts that review the clinical trials of a particular drug for us to assess whether or not it be appropriate for patient care. Now, occasionally, they will put a brief abstract or drug ad on step 1, and typically when they do that, it's very limited to only pharmacokinetics. And so a classic one would be to give you a clinical trial study on a particular drug. But what we do when we give you the ad, we also give you dose response curves where you have to assess efficacy versus potency. And then we ask you some questions related to those pharmacokinetic elements and pharmacodynamic elements as to whether or not this could be an appropriate agent, right, to look at a particular condition. So, but most times you'll see these, the majority of time, the drug ads and the abstracts on step 2 and on step 3 because they do involve advanced clinical reasoning and understanding with some application right from step 1, which is the underlying pharmacokinetics and pharmacodynamics. But now, how are these drugs actually working to treat patients? What does the data say about effective dose? What does the data say about lethal dose? What does the data say about outcomes for the patients, et cetera, et cetera? And you got a certain amount of time to read that, digest it, integrate it, and then answer questions about it.
Yeah, so we might have to have a little side, a little
That might
special,
be a special
special,
edition.
special,
Yes.
special to talk about how to attack the drug ads, because oftentimes you have 3 pages of ad and just figuring out what to attack. I mean, you have to read the ad before, you get to the question. So you read the questions, but the information to answer the question is in the drug ad. So similar to the MCAT context with the reading reading
Yes.
skills,
Mm-hmm.
what what is the tactic or the strategic approach to the drug ads when you have 4 pages of information? You might have 3 to 4 different charts, different types of graphs, and looking at what the question is asking, like what's the stepwise attack mode for that? So we'll have a probably a special FS on that, but I'm glad that format type is being highlighted here because if you're a student like me, a trainee like me, I was a student at one point, but still a student, still a student of life,
Mm-hmm. That's right. It's,
always
lifelong
learning,
learning.
right?
And you know what? We can give them just a coming attraction on that right now. The biggest coming attraction for the strategy to address it is again to understand the blueprint of the exam. Let's go back to it. If you're in step 2 CK, we're looking at diagnosis and then ultimately next step in management. So if you're looking at the pharmacotherapy context, that's management. So the question is likely to revolve around management. So what in the ad would allow me to assess the efficacy of this drug in managing my patient? So that allows us to zero in very quickly on specific aspects of the ad that focus on, well, what were the outcomes in terms of how this drug addressed a particular medical condition, and then what were the adverse effects, so on and so forth, if any, right? Because you need to know that if you're going to use it to manage your patient as well, because it could be contraindicated. So there are keys based on an understanding, again, of the blueprint. Once in that next special edition that we do, when we look at how the ads are designed, we will understand which sections of the ad give us what information that relates to the blueprint. Then, based on what the question is asking, we hit that section. Watch this. When I have a blueprint and a strategy, I can execute on the game plan. When I don't have a blueprint, I have no idea where I'm going, and that's why I'm all over the ad, because I don't have a strategy, because I didn't know the blueprint.
Exactly. Searching for the answer.
And I'm hoping I find it. And guess what? You're going to be driving around because that GPS is not working. Recalibrating. And while you're recalibrating, the time is moving, and then the mental saboteur comes. Oh, you spent 20 minutes on this question. How did that happen?
Yeah. So
Gotta be careful.
coming to traction. We gave you a
Yes.
little piece, but that's something that we will touch back on. So those are the three. We had three format types. So the last one, it's a very unique one because it fits into a category really for only one of the exams. And this format type is simulations. So give us a breakdown about what is simulations and what is the purpose, where it's placed in this continuum of our USMLE step exams, and what's the purpose of it.
So we see what we call computer-based case simulations, right? The computer case simulations. Yes, CCS. These are seen only on the step 3 exam. And in a moment, we're going to break out a little bit more of the format of the exam, but step 3 actually has 2 days. The first day is called Fundamentals of Independent Practice, FIP, where we focus on all the basics of managing patients. The second day is called Advanced Clinical Medicine, or ACM, where now you deal with very sick patients, comorbidities, so on and so forth, and it's long-term management of those patients. Those are all the multiple choice questions, but the computer case simulation, CCS, no multiple choice. This is where the computer gives you a case and you tell the computer exactly what you should be doing. From how you initially assess the patient, work up differential diagnoses to final diagnoses, to what labs you're going to order, and based on your labs and your imaging and anything else that's appropriate, okay, how you're going to manage the patient.
So all of your OSCEs and clinical rotations have
Exactly.
all been to lead up to this point because
Everything
you
you've
are
done in clinical rotations,
typing things in.
that's in medical school, right? Step 1 and then step 2 CK, all of that. And now remember, step 3 is typically completed for most graduates, physician graduates, at the end of their first year of residency, the end of their internship year or PGY 1 year, they will complete step 3. So at that point, you've been managing a lot of patients mostly independently, but you're still being supervised by a senior resident or attending physician as you move now to your residency. So it's expected now, because remember, step 3 says you can manage a patient unsupervised. This is the safest way to determine that, right? Is to take you through that entire scenario. So that's a separate type of preparation to prepare for the CCS, or computer-based case simulation, which is only part of step 3 on day 2 advanced clinical medicine.
So as we had those four format types, we talked about the single item multiple choice question, the sequential sets, the abstract drug ads, and then also the simulations. And we talked about that between each exam. Now give us a total exam load. What are we looking at? Because you said one of the exams, as I know, you sat through this exam, step 3 is a 2-day exam, and it grades up from step 1 to step 2 to step 3. So just give us a little bit of information of how many questions are on each of these exams and what does the day generally look like between each one.
So your step 1, USMLE step 1, it's a full day exam. So it's 7 blocks of questions, and each block has 40 questions. So that's a total of 280 questions. So it's a block of 40 questions. You have 1 hour to answer 40 questions, and that's 7 blocks or 280 questions. So it's a 7-hour exam, but you also receive 1 hour for breaks and lunch. So it's an 8-hour day, 7 hours of testing, and then the 1 hour of breaks.
And that 1 hour break you can break up
You can
throughout.
break up anytime throughout the day, right? There's a timer associated with that, and you'll follow that process for your break time. Of course, when we talk about strategy for the game day, we kind of make recommendations about how one might want to consider taking their breaks.
Right. After each block, or
Right. It could be midway
skipping a block,
between.
maybe
Right.
taking a longer
Depends on
break.
the
It just
scholar.
depends on the
Right.
scholar, yeah.
Now, the step 2 CK is even a longer day. That is 8 blocks of questions, not 7 blocks, but 8 blocks of questions. And in that particular exam, it can be, we like to say, up to 40 questions per block, but most of the time it's somewhere between 35 to 37 questions because the vignettes are longer. And the total number of questions for the day is typically 318 questions for the day. So you see there's an increase in number of questions. There's also an increase, as we stated earlier, based on the blueprint and the complexity of the questions, because now you're doing diagnosis and next step in management. That's a long day. So that's a 9-hour day, 8 hours of examination, 1 hour of breaks. All right? That's a lot.
Getting sleepy just hearing it.
That's correct. A lot of people do. Now, your step 3 exam, that's a 2-day exam. 2 days. And as we said, now most scholars do not take the exam back to back. That would be a mistake because it is cognitively fatiguing. Because on the first day, fundamentals independent practice, you have approximately 230 questions across about 6 blocks. And they're of course, multiple choice questions. And they could also be sequential sets. They're the drug ads. So there's a lot. All right. So that's on what we call day 1, fundamentals independent practice. Most scholars will schedule the exam where they have either a 1 or 2 day break in between day 1 and day 2. Day 2 is advanced clinical medicine. You have a series again of multiple choice questions, several blocks you must do for that. But you also have the computer case simulation questions, and you'll have up to 13 cases for the computer case simulations. So that's secondary. And as it relates to the multiple choice questions, it's approximately 180 questions across several blocks of over the course of the day, right? So they again break it up into blocks, but in essence, you got about 232 questions on day 1, FIP, multiple choice. Day 2, advanced clinical medicine, you have the 180 questions, and then you have the 13 computer case simulations.
That second day is
That's intense.
it's an intense day. So scholars, just your big brother giving you some advice. Don't schedule the exam back to back. Just the cognitive fatigue from the first day, and the first day is a little bit manageable. But doing the first day and then the second day right after, and the second day is you're gonna have to pull that grit out. So
Yes.
that second day, so just doing it back to back is really is not recommended. Obviously, different scholars may
Yes.
have different barometers, right? However, I would say in general, it's probably not the best idea to take the exam back to back. Now, when you do register for step 3, it's a 2-day exam, but you have a 2-week period of time in order to schedule those 2 days. So you have to schedule day 1, and then within 2 weeks, you have to schedule the second day. It's probably not the best recommendation to wait too long, to wait for the full 2 weeks, because you don't want to have that much of a gap in between the day 1 and day 2. But definitely taking it back to back is probably
Yes, very, very few scholars have attempted that. The ones I've worked with over my 35 years who have always said they were literally drained, and they would not recommend it for anyone. Sometimes because of circumstance and how the residency schedule is working, and they just couldn't get a day in between. But most times you're able to break it up because you can work with your program director and your residency to schedule that appropriately. And just having at least one day just to rest your brain is just extremely helpful, because the advanced clinical medicine, that's why it's called advanced clinical medicine, you're going to be working with some very ill patients. And so you need to be able to think appropriately.
Cognitively sharp.
Exactly. So that, in a nutshell, is our segment 2 in looking at those different types of question formats. And we might just also mention that on the step 2 CK and on the step 3, you are likely also to see elements of the electronic medical record, EMR, sometimes called electronic health record, EHR. They'll pull up elements of that because you do that a lot in
You're
your
talking about the
clinical day.
question, correct?
Yes,
Yeah, so
questions
those are the
about it.
question type where it says it comes up with the demographic first. So
Exactly.
male,
I love it.
the
Mm-hmm.
age, unspecified for, something else,
Whatever
and
their
then they'll
condition
give
is,
you
exactly.
like a quote of what the chief
Chief
complaint
complaint is.
was, is, then they'll give vitals, they'll go through the physical exam. So
Mm-hmm.
it's a different question style than the normal
Mm-hmm.
vignette. It
Mm-hmm.
basically gives you the information that would normally be in the vignette in a EMR
More similar.
simulation type of presentation.
As we say, it's almost like getting the bullet.
Right, exactly.
Right?
And
We talk
so
about just give me the key
just give me the
component of what's
key
going on with the
components, right?
patient. And that's what you typically get when you're getting ready to go see your patient. And so it's another way to evaluate your ability to receive information in that format and then make an informed decision, right? Because everything's not going to be written out as a beautiful paragraph.
Right, exactly. And for some scholars, that those style of questions, the EMR style, is it lights them up when they see it come across, when they press next and they see that one come across, because they don't have to go through a full
Correct.
paragraph vignette.
Correct.
They can just hit the points that they know they need to hit. Once
Mm-hmm.
they've read that qualifier in the vignette, they can go through the EMR and see, put the information together to track what might be the differential diagnosis.
Yeah, which is another, as you said, a way to approach the question and think about from a strategy point of view.
Right.
It's what you're used to doing already, so you do not need to be intimidated by it. In
Exactly.
fact, you can be used to your advantage.
Exactly. It could be used to your advantage. So definitely these different format types, and style types, we want to look at the ones that are more of our strengths, look at the ones that are more of our weaknesses, and then in that dedicated time that you have when you're studying and preparing for your exams, knowing what the format looks like and identifying and have realistic self-appraisal about what your strengths and weaknesses are across the different format types of questions, it can give you a little bit of more information and be more intentional and directed about how you prepare your study process.
Very insightful.
Yeah.
Well, DJ, we're going to close out segment 2, and we're getting ready, scholars, for segment 3. As we say, we know what you want. You want the questions. So coming up after the break, we're going to be engaging in a lot of questions across step 1, step 2, and step 3. And while we go on a short break, as DJ said earlier, you know you love the content. Let's like it, let's subscribe, and let's share it. We'll be back for segment 3 in a moment.